Countries who have faced the first wave of COVID-19 back in March would be more prepared today to face a potential second epidemic wave this autumn because, for one, there are tests to detect COVID-19. Facial masks are readily available and people are wearing them. And intensive care units, at least here in France, have increased the number of beds from 5,000 in March to 12,000 today. And also, intensive care units know how to care better for people who have a severe case of COVID-19 because some procedures have been standardized. And at the same time, there are other parameters to take into consideration. For one, back in March, in France, there were only 3 big clusters, which made it possible for patients to be transferred from one hospital to the other. Secondly, we're now entering winter, which means that we could face an epidemic of seasonal flu. But if you actually look at what happened in the Southern Hemisphere during this winter, because they're just coming out of winter now, they had very few cases of seasonal flu. So why is that? Scientists are trying to understand. Either it's because they were wearing masks more and washing their hands. Either it was because many cases of the seasonal flu were actually misdiagnosed for COVID-19, or, and that's what scientists are trying to figure out, there could be a cross immunity between the seasonal flu and COVID-19. What's for sure is that as of now, no one can say for sure if there will be a full-on second epidemic wave and if it will be more fatal.